is important for calving and everything is knowing your dates when the bull's out with the cows, when you take them out, and when you're going to be expecting. Do you guys know how long gestation it is? Varies. Good. Yeah. Do you know, like for Angus versus Hereford or Angus tend to be a little shorter, I think.
Oh, do they?
Oh, you know. Well, that's definitely true. That's a great thing to say is that there is a range. Each cow tends to have her own set of days that she will calve at. So there's a, the average is 182 days, but it could be anywhere from like 170 to 190. So it's good. 200. I'm sorry.
So how many months is that?
9 months.
9 months?
Around there.
Pretty much close.
Yep,
Okay.
yep. So it's good to keep records to know when they were bred. So when if you need to call the vet, you know that's going to say when was she bred, when was she due, is she calving on time, is it late, because like you said again, when the calf is about ready to be born, do you know how much weight it puts on per day? Half a day. Yep. So, if she's calving late, that's a lot bigger of a calf that she's got to get out. So that's one thing to keep an eye on. And then the next thing is to know how long she's been working at it. If she's, do you know what's impending signs of partridge knot? Shoots them off? Anybody?
Sagginess in the back.
Ligaments, yep, they're all saggy.
Say that question again.
Her ligaments loosen, like she gets a little saggy in the back.
Oh, okay.
The tailhead looks a little bit more prominent.
That's a sign of
impending parturition birth.
Okay.
Yeah. She'll bag up about a week or 2 weeks beforehand, so that's not of an acute sign. But you can also see her vulva get enlarged, get a little bit edematous there. And
would there also be a discharge possibly?
Possibly, yep. And then one of the biggest early, closest to signs of impending parturition is more her attitude. When she doesn't want to eat, when she's walking around, pacing around, those are signs that she's looking for a place to, deal with this. She's starting to get a little uncomfortable and having to focus on other things other than food. And so then once she's started to calve, and maybe you see some feet coming out, but she's not making any more progress, do you guys know how long you should go at it before?
No. How long do you wait?
Well, if you can get in there and feel the position of the calf and help her along, but if you're not making any progress after, say, working at it for half an hour, that's about when you need to start thinking about other things, calling the vet, going to your other resources for that sort of thing. And we've got these phantoms here with all these different positions we're going to have you guys all feel, and you guys tell us what you feel. So, what's the normal position for calving? Do you guys?
Front feet.
Front feet forward? Yeah. All right, and so what about backwards? How do you guys tell if it's coming out butt first? Well, not butt, but just like rear end first, hind legs.
You feel the tail. Yeah.
The tail's one, but if they have the hind legs out, how do you know they're hind legs?
Are they upside down?
Yes, exactly. So that's one thing to check on that. And then if you get the butt, then you feel only the tail. That's called a true breech. That's a really big emergency. You need to not even deal with it. Call the vet right away. Leave them alone so you don't get the cow and the calf stressed out. And try and get someone out there to help that. And, if you leave it too long, you might be looking at a C-section or a dead calf. So the next thing is about the tools that you're going to be using. And you want to keep clean. This is the number one priority. You want to make sure you clean up yourself. Gloves are always great to use. Keep clean gloves. And all your tools that are metal and things that can be washed. It's great to keep them in a bucket with some antiseptic. And the best one out there, we think, is Novosan. It's chlorhexidine solution, usually like 1 or 2%. It's blue. And put a little bit in the water to make it a nice clear blue, maybe a little medium to dark color. And you can just stick the chains in there. You got nylon pulling chains. You can use those and put them in there too. They're a little bit difficult to clean, but that way all your tools are clean. You're going to be wearing gloves. You're going to be clean, and you don't want to introduce anything in there because that calf has no immunity at birth. And so that goes to other tools you need to have ready. Is you need to have maybe some colostrum ready. And this is colostrum, thick, nice and yellow. Saving it, keep it in the freezer. That's always a great resource to have. Otherwise, if the cow's doing okay and you got the calf out and she's easy to handle. You can milk her out right then and there and put it in the calf like a tube. This is an esophageal feeding tube. Again, another piece of equipment you should keep clean and disinfect it, clean it out real well, dry it off. You can store these, in a bag so that no dust gets on it or anything. You can break it out right away. It's nice and clean. And this you'd put into the esophagus, which you'll usually see it coming on the left side of the neck. And when you get in there, when you can see it pushing down through their neck. And you can give them the colostrum this way. Do you guys know how long it takes for the colostrum to take effect? I don't know if you guys heard that from the last period. It's about 2 hours. So in those 2 hours, if you've already given it some bug, from you or from the cow to the calf, already you're behind the game there in trying to stop that infection from taking hold of the calf. So then the other thing for calf rearing, when you get them out and they're not breathing, do you guys know what to do to try and help that along? Get them breathing? Good. Stimulate the lungs, their sides. You can drain them, pick them up, rear end up, try and get any of that mucus or fluid that might have gotten in there to drain out, and that also will stimulate. Another good tool to also use is just put some straw in their nostril, kind of tickle their nose. Nothing like hard stick or anything, but just something to just tickle real softly and gets them to kind of sneeze or make that first inhalation to get those lungs aerated. And I'll see here. Then about science for actually pulling the calf. Do you guys know how much strength you should use? Generally, they teach us a 2-man rule. So if 2 strong men can pull the calf, that's usually sufficient. If they can't, then you're looking at some sort of problem that you got to investigate. And just don't keep hauling on her, because you might cause damage to that uterus. And then one of the other big things that's important for this is lubrication. If she's been at it for a while, she'll be dry, and it's really hard to get a furry calf out, even if especially if it's backwards and the hair's going the other way as you're pulling. That's a real big barrier. And so, do you guys know what you use for lubrication? Do you guys have stuff that you go reach for, or
Mineral oil.
mineral oil? That's a good one, would you say?
Vaseline.
That's a little bit thick. What we would recommend is, let's see here. You can use KY if you can get enough of that. This bottle here is called J-Lube. It's a polymer. It's a synthetic thing that's actually a powder that when you wet it, it becomes real slimy, real good, slick surface. Gives you no resistance pretty much. It's really good as a lubricant, but it even says it on the bottle. If you have a tear in that uterus and you get some of that into the belly, the abdomen of that cow, she will develop a raging peritonitis and most likely cause death. It's very, very painful. There's not much you can do about it once it's in there, not much treatment, and it almost invariably will cause the cow to die. And so even if you come out of this with a live calf and that happens to the cow, then again, it's not been a successful birthing. So this is a really good, cheap type of tool to reach for, but if you're going to consider a C-section or if you're going to do a lot of manipulating, those are 2 things that you want to consider and maybe not use it. Especially if you think, if it's a breech and you want to save this calf and we might be doing a C-section, don't even use it at all. Because when we go in there, we're going to have access to the abdominal cavity, holding the uterus outside of the body, and we want to make sure that none of that gets in there.
What about just regular dish soap?
Dish soap can work, yeah.
It can work, but remember when dish soap dries, it's pretty irritating.
Yeah.
So you're better off to use just water and Novosan,
Okay.
or mineral oil, or KY jelly.
Mineral oil better than the jelly?
Well, it's not necessarily better. The only thing is, if you get about that much J-Lube in the peritoneal cavity, in other words, if you make a hole in the uterus inadvertently, or there's a C-section done, you get about that much in peritoneal cavity, the cow will die in about 24 hours. So once you reach for this stuff, this is good stuff, but once you reach for it, also remember it says right on the label, caution, leakage of this product into the peritoneal cavity may cause illness and or death. It causes death. They're not ill very long. They die within about a day.
Can you use a betadine solution?
You can use betadine solution. Novosan is a lot gentler to the tissues. than iodine is. Iodine is a fine disinfectant, but it's, what's this, Dan?
That's just some AI loop.
Oh, this is AI lube. This is like, this is more like KY jelly, isn't it?
Yeah,
Yeah.
it's just regular palpation loop.
Yeah, this is palpation lube versus J lube. Yeah.
OB loop, whatever you want to call
Artificial
it.
Yeah,
insemination.
this is methylparabene. So this is like KY jelly, and that works good. That's just as slippery
Oh, yeah.
as the
Yeah, yeah.
as this stuff without the danger.
Yeah.
So if you got a calving deal, you may want to just get a gallon of that, and just but you got to keep it cleaner than this. See this dirt and stuff like that.
I don't know.
Would you have to pull the calf if it was presented properly? Is it possible? Okay. I mean, how do you know if you have to pull the calf?
Oh well, remember Michaela said that if she's not making progress in an
Right.
hour or so,
Right.
then it's time to go do something.
Okay, so then it probably is
She could have a hip lock or shoulder lock.
not,
Yeah.
the calf might be presented improperly.
Or the cow just may be lazy.
Oh,
I mean, you get into that thing once in a while too. Some cows aren't real vigorous in this whole process.
I found that more in heifers that were in too good a condition before calving. So you don't want them too fat, but you don't want them too thin. Just like Goldilocks, just right.
It'd be just right.
Because
Yeah.
the fat ones, they'll lay
Really,
down,
this baby bear
they might
is
push a
just
couple
right, isn't it?
times, they're not making
Oh,
progress,
this
they
is
get
a
up and they start
house
wandering
worker.
again. They'll keep on that for 2 or 3 hours, they won't bear down and really go with it. Generally speaking, with heifers or cows that are too fat, you'll run into that problem.
So we've got some calves. I'm sure they're all normal, but you guys grab some gloves and feel these 4 calves and see what you think is going on in them. So just go around and reach into those. This is a cow, a blue cow here, and reach in there and see what you think as to what's going on. Right here. Anybody remember that one? That was number 3.
Good teeth, but no other leg.
What was that now?
But no other leg.
So there's 1 foot,
1 foot, and you can feel the mouth.
and where's the head at?
Back on that side, kind of like this.
So it's got one leg back, one front leg back. Is that what you're saying?
Yes.
Yeah.
Oh, and I can feel the head. It's right there by the leg.
Yeah.
So it's got one foot coming out, head's coming out, but one leg's back. Okay. So you're gonna have to get that thing straightened out, right? Because
How do you
it's
do that?
coming out straight. We'll talk about that. What's going on with this one?
You got all feet, no head.
Yeah, 3 feet.
3 feet.
He's
Oh.
turned out his
And
leg.
what about those feet?
They're all messed up.
Yeah. What do you? I mean,
Oh, yeah.
those are the back. Those are the back feet, aren't they? So this one's coming out backwards, but straight, and it's kind of off at an angle like that. Okay. What's this? What's going on with this? This is number 5.
Head to the back.
Oh yeah. Got what's coming out first? What can you feel first? 1 foot forward, and then the head's flop back. So that's 2 problems. Head's flop back, 1 leg's back. This one's got 1 leg back. What's going on with number 9? Breech calf. So both of them are back. So what you do when you're trying to straighten out a leg, so you've got a leg back, whether it's 2 front, whether it's 1 front leg or whether it's 2 back legs, what you do is you grab them by the hoof. So you grab them down low and you move everything you can to the center of their body. Don't try to get it out to the side, but move it right to the center and bend that most distal joint, the furthest joint down toward the hoof. Bend it and then pull it out straight.
What's got to go like this?
Yeah, so it goes in and then and also you usually have to kind of push the calf forward a little bit. Don't push it so far that you push it through the wall of the uterus, but just kind of edge it forward so it gives yourself some room away from that pelvis. You want to get it away from that pelvis so you got some room to work. You push it forward, grab the foot. Don't grab the top of the leg, but grab the very bottom of the leg, the foot. Move it toward the center and start flexing it and bring it out that way. Does that make sense? And it doesn't matter whether it's a back leg or front leg.
Okay, but the back legs are facing forward and they need to be facing back.
Well, that's okay. The back leg is facing forward, like in this calf right here. Everything's forward. The only thing coming out is the tail. So once again, you move that. You're not going to be able to turn that calf around. That's not going to happen. So you move that leg to the center of the calf, flex the foot, flex the next joint up, flex the knuckle, and bring that one, and then put a chain on it. Put a chain on it. Out of your disinfectant deal. So you put a chain on it, and you can just put one chain on a time, or you can go ahead and chain it up, and then just put a handle on it, and just leave it there. And then go in and get the other leg. And do the same thing with it. Bring it out, and then you've got a handle and the chains on both. You do 2 of these half hitches, one above the fetlock and one between the fetlock and the claw or the hook. So you spread out that pressure. If you just put one around, it's a lot of pressure, and you can break a bone or damage the nerves or damage the blood vessels or something like that. So then you got your handle on it, and you're kind of started out, and hopefully you can pull that calf. Now, if you're going to pull the calf, what direction do you pull it relative to the calf?
Down, I think.
Down.
Down. Now, why down?
Gravity.
Gravity. Excellent. What other reason? So you want to pull down this way and not out this way and not up, right?
That's the way the cows pull.
Okay. And if you pull, here's your fixed point, the pelvis. It's not going to move. It's not going to change its shape or position. So if you pull down like that, what else are you doing to that calf?
You're lifting the tip of the
You're making it longer.
Toothpaste.
Toothpaste, exactly. You're making it longer, and so that skin can get to a smaller diameter. So you pull down at as steep an angle as you can. Excellent. That's great.
Now, is the one over here where the back legs are facing forward,
Right.
do you have to move the back legs back? Do they have to be turned so they're going back?
No.
They come out? No?
No, you just
They'll
and
naturally do that?
they can be born backwards.
Oh, okay.
There's no problem.
Oh.
It's harder for the cow to push out a backwards calf than it is a forward calf for 2 reasons. One is most of the weight is in the front end of the animal, right? The head, the shoulders, most of the weight's there. So gravity's working against her. And then the calf natural tendency to move is to go like this, right? So he's trying to go the wrong direction. And then she doesn't get stimulated very well. She doesn't get stimulated very well by that head and feet going into the vagina. Part of the stimulation of calving is to have something presented right in this area for the cow. And because there's not much being presented, she doesn't push as hard as she normally would. Plus, the calf's trying to go the other direction anyway. He's going against traffic, going the wrong direction. So anyway, so you try to, but you can still pull them, and you pull them out and over and down.
One more. Oh, I'm sorry.
Go ahead. One is when the umbilical cord and the placenta separate, because there's no oxygen
Which
supply.
usually happens outside the cow,
Which
right?
usually happens as they come out.
When the calf's head is out in the forward presentation, head's already out, so they can start breathing.
And if they're in backwards, as Dan said, and they start breathing in there,
Then they aspirate and then
then
they
they
go backwards.
aspirate the fluid.
So do you have to have a syringe to get that, or
Well, the easiest, the
just turn them
syringe,
upside down?
yeah, the syringe is fine, but it's better to stand them upside down. Just grab them by the back legs and hold them up and let it drain out. And that also stimulates them to start breathing too. And when you're manipulating that calf, trying to pull it, that stimulates them to start breathing. So as Dan mentioned, once you start pulling, particularly a backwards calf, you got to keep going. Don't take the coffee break and have a donut. Just keep going and get that calf out.
These are pretty static demonstrations. There's a lot of dynamics that are going on.
A lot of
What are you going to feel like in terms of, is the cow going to be squeezing like this to get
Well-
the calf out, or is it going to be like...
No, I mean you can Why don't you answer that one?
Usually at that point in time, she needs help. She's kind of gotten weaker, so she doesn't have those strong contractions. I mean, maybe initially just getting in there, she may resist you a bit, but shouldn't be too bad because she's, obviously dilated for the purpose
But
of calving.
what are you going to feel? You're going to feel quick,
No, it's going
short
to be.
things, or are they going to be slow, long,
You
strong?
don't feel much
Not
in
much?
terms of the contractions.
And there's going to be a
because-
lot of pressure to begin with.
Because you're really not in the uterus. I mean, the cervix on a pregnant cow, the cervix is right about here.
Okay.
And so the uterine contractions are way back here. So you're not usually going to be in there. The cow will kind of grunt.
So anything you
She'll kinda
feel
take a
is going to
deep
be
breath.
something pushing against the calf.
Yeah, you don't feel much when you're
see
pulling them.
You'll
No,
see her when she's contracting.
you'll see her.
She'll blow up,
Yeah.
and then she'll push, and that's when you know. And you can induce her to contract. I haven't started talking about those yet, but you can make a lot of progress with a lot of lube going inside and just running your hand.
Slather 'em
around the
good?
calf. Just running your hand back and forth around the calf, and you'll feel it'll kind of loosen things. I mean, then she'll start to dilate more, but you'll also induce her to contract. I mean, you can feel, you can see her.
And that's where this is really nice. Put it on your glove and just lube everything you can. And while you're doing that, assess how much room is between the calf and the wall of the vagina and the uterus. And if you're and the bones. And if you just barely got the head started and those shoulders are jammed up against that thing so tight you can't get your fingers in there, that's time to say, I don't think this is going to work. We're going to either have to do a cesarean section or something like that. That's the time to. But if you can gauge with your hand and say, well, there's the shoulders. That's about the size. Here's the pelvis. I think things can come out. Then you just kind of use your own intuition and let it guide you. So many mistakes that we see are people who get something set in their mind ahead of time and then just go try to accomplish it, no matter what. So take a good gauge. Feel how much room is around there. If you don't think there's much room, then go, well, maybe we shouldn't start this project.
When you're talking about pulling and you talk about the gravity, each one of these setups is a cow standing up. So you got a cow laying on its side.
You got
and
different
then
angles,
you've got
don't
a
you?
different angle going. So then what?
But relative to the cow, it's the same. If we tip this thing over like this, the angle we want to pull at is still this angle. It's
Okay.
still the same angle. If she's all the way over on her side, it's
So you're standing toward the back of her feet and you're coming.
yeah. You're going toward the back of her feet
Okay.
and pulling out and down relative to the cow. Relative to the cow. Doesn't matter if she's upside down or on her side or partially on her side. It's relative to the cow. Out and down.
Personally speaking, I would rather they were laying down.
Really?
I don't know what that.
Yeah, and it's just a lot
Do
harder.
they
That
normally
doesn't
stay
mean chain
still
with a
for
tractor
you
or
though
going
if you're
or-
helping out?
Drive down the road till it.
Jiggle it as you go up.
Yeah.
There was a question.
Dan and Michaela, this lady had a really good question. It says, do they normally just lay still for you to do that? What would be your response to that?
They may grunt when you're going in there. I mean, they don't usually kick or and react harshly to that. I think they know that you're trying to hold them, and they may have a contraction. They may contract on your arm, and you feel that pressure, but they don't normally.
They're not gonna try to get up and run away from
No.
it.
Oh, well, they'll do that.
Yeah.
They will do that.
Yeah.
The biggest challenge you're gonna have is getting them in whatever setup you have. If you just have a head catch between two posts and some panels that you can move. The biggest challenge is there's some women here that I don't know if you've had kids, but hormones go through women and things just go out the window. So getting her restrained. Once they're restrained, there's a lot going on. I mean, she's giving birth. She's in pain. She's stressed. There's a lot going on. I don't know, as many as I've calved out, I don't think I've ever had one that's ever tried to kick me or anything. Once I got them in, getting them in might be a challenge. But once I got them in, they're pretty much not worried
What if
about
they're just
me.
laying in the pasture? Is that okay to try to do it there?
What's the advantage? What's the advantage of them? Just you go out in the pasture and help them. What's the advantage of that?
You don't have to move them.
Don't have to move them. That's good. What's the other advantage?
Might be cleaner than this.
It's cleaner than the corral. Excellent. What else? Less stress. It's quicker. What's the advantage of bringing them into a head squeeze and a calving area? What's the advantage to that? You got all your tools with you, right? You got all your stuff that you're going to need. And if anything goes wrong, you're in a more of a controlled environment, right? So that can be very, very helpful. What's the disadvantage? It's all dirty. I don't care what operation it is, whether it's here or our ranch, or it's just dirtier than it is out in the pasture. And there's a little bit of stress that went on to get them in there. So those are things.
So after you have a cow if you have to pull a calf, what should you do for the cow afterwards? Should you give them any kind, like we had a cow that last Sunday that had a calf and she was too big for the cow. And we didn't find her until the calf was dead. So we ended up having to pull the calf. We gave her some penicillin and some tetanus just in case, because we did have to get her in the chute, and it is filthy. But we couldn't get the calf out otherwise, and we didn't want to lose both of us. What, I mean, did we do what we should have?
No, I think that's good. You know, what do you think that?
At least you don't have to worry about the calf, but what you want to try and do is get it out and not traumatize the uterus as much as possible. And then after the calf's out, it's a good idea to put a fresh glove on and feel the uterus and see if you can feel any abnormalities, tears, or anything like that. And don't try and pull the placenta though, because that.
She delivered that.
Yeah, okay. That'll come out on its own. You can actually traumatize the uterus by pulling it out. But, having a protocol like antibiotics, maybe a tetanus, things like that, would be a good thing to have set in place after already discussing with your veterinarian what kind of things would be good to have.
It was Sunday morning.
It's a good thing. Now that this is happening.
It was 7 o'clock on Sunday morning.
But what Michaela's talking about is you probably should have some kind of protocol on how to treat pneumonia cases.
Right.
How to treat pink eye cases. Anybody have any foot rot cases?
Right.
Calving problems or retained placenta. You probably should talk to your vet often enough that you've got a pretty good idea about what you're going to do for these common conditions in terms of antibiotics, pain relief, other kinds of things.
Yeah, we didn't have a protocol because we haven't had that probably.
Well, and that's a good thing not to have. But
It's a wake-up call for you to look into it.
yeah, look into that because you're.
We live up here, so there are hardly any large animal beds at all.
And you've got nothing. Everybody's got something in common with that. Because Michaela here next year, this time is going to be a young large animal vet. I'm still a young one because they're so few of us.
Yeah.
You've just been young longer.
I've just been young longer. Yeah, I joke. When I started out in 1973, I was a young veterinarian and a young cattleman, and now I'm still a young cattleman and only a middle-aged veterinarian. And I'm old, period.
When I would get a vet call or have the vet come, I had a scroll. I mean, when I pay for a vet call, I write things down all the time, and I have questions. And if I'm paying her to come, I get my little list out, and I nail them with questions the whole time they're working. And
Doc, while you're here.
information. Yeah. If you've got them there, I mean, it doesn't have to be just what they're doing. I mean, you can just start pelting questions, and that's your ranch call. So I figure I'm going to get my money's worth while you're there.
Well, and not just the money's worth, just the information.
Well, yeah.
I mean, because as veterinarians, we would rather educate you how to do this stuff than to just be fire engine type deal. It's better for the cattle. It's better for you. It's better for
We're
us.
only a week postpartum on this cow. Should we watch it for anything with her?
Yeah, you should watch for any abnormal discharge, any straining on urination, any
smell.
inappetence, any bad odor. Yeah, you should
Including
watch for
breath.
all this. Huh?
Including the breath.
Including the breath, but mainly coming out the other end. Does she have an infected uterus?
Don't let her get all the time.
No, she wanted to eat right afterwards.
Yeah, that's good.
She was like, yeah, she wants some water.
And when will you start your breeding season? When will you start? When will you put the bulls in? Is this the tail end of your calving or the front end?
It's the front end.
Well, no, it's the tail of the calving season for us.
Oh, yeah, May is the tail end.
Yeah, so at some point in time, I would examine that cow, make sure she's cleaned out okay. Make sure she You know, because if she's got an infected uterus, even if it's a low-grade infection, she won't breed back. She needs to clean that whole thing out. So that's good. Probably some antibiotics.
Keep her out of the field for a year,
Keep her out of the field for a
for
year.
breeding. Keep her
No.
away from the field.
No,
Breed late.
no. I mean, you want her to have a calf every year, right?
Yeah.
If she can't have a calf every year for you,
It's not a contagious type thing.
no. No, you want to get her cleaned up and get her back in the calving program as soon as
It
possible.
was just a freaky thing, big cat, small.
And that's the thing about any of these dystocia problems.
12 to 14 months of age. You want them to calve as 2-year-olds, and you want them to calve a little bit ahead of the rest of the cow herd.
Why?
So 12 to 14 months of age.
No, why do you want them to calve before the other?
Oh, yeah. Why do I want them to calve before the rest of the herd? Because that first year, that first calf heifer, that's the hardest change in the cow's life. Because all of a sudden, she's still growing. I mean, she hasn't reached her mature weight. She's still growing. She's got a calf on her that's taking milk every day, and she's trying to get rebred again. I mean, that's called juggling. And so that's why you want to give them a little extra time for their second year. The other thing that's important to understand is your best producing heifers, what the heifers that are going to produce the best, have the biggest calf, have the most milk, etc., have the most stress on them. And if you don't give her a little extra time and she doesn't get bred and you get rid of her, what are you doing to your genetics and your herd? Every year, you're getting rid of your best heifers. That's not very good management, is it? That's not taking you where you want to go. So that's why you want to breed them at 12 to 14 months, which means they've got to be big enough and everything to get that done.
Some produce
Calf, I think you demonstrated that pretty well.
Yeah, just put them on, make kind of 2 half hitches. And most of us use chains because they clean up better than straps. But I actually like straps fine. Nylon straps are good because they spread the pressure out a little bit more. But these chains are meant to form a half hitch there. This would be the dew claws and the fetlock joint, and then just another half hitch here, and then pull from down here.
If you look where the pressure is,
It's spread out.
it's not on the soft tissue, it's on the bony part.
Yeah, it's spread out. You can get a chain and do it on your own arm. And you
It's
can
not-
feel.
It's not the kind of thing you practice inside a cow.
You can,
You do it blindfolded several times.
Now,
you can feel the pressure. This is a lot less pressure.
when you're putting those on too, I slip the chain, just like you're doing over your wrist. Then you put your hand inside the cow so you can slip it.
Grab the foot.
Like for instance, exactly.
Grab like that.
Yeah,
Grab like that. Half hitch it.
yeah. So you put it on yourself first. And I don't know whether you
Blindfolded
demonstrated
6 or
that.
7 times.
Then you reach in and grab the foot, and then it slides right over your hand onto the
I do it a
foot.
little different. I put it with my thumb like this.
How
So
come?
because sometimes when you go in, it's pretty tight in there. You go in, that rascal starts working up your arm. If you put it on like this, and then I can use my thumb too. And I can use
Okay,
my
good
thumb to
idea.
tighten up. And then I can spread it with my thumb. I can manipulate however I want. And something else that's important to remember when you put these on, if that's the front of their hoof, pull from the bottom. Make sure that that's on the bottom. You don't want to, as Dr. Moss said, you can put it on your own hand and do it like that, and you're going to pull it you're going to make a kink. If you do it on the sides or try it from the top,
It works a lot better to do it from the bottom, and all your angles work for you instead of against you. You don't pop a hook off. You don't break a leg. You do all those kinds of.
And in a lot of cases, women have smaller hands.
Right.
We do get in there better
Right.
and do that.
And that being said, there are some times if you calving up these rascals, there are some times when the only option you have is to get it on like that. might be the only option you have. Then, when you get it, and you can pull the foot out a little more where you can manipulate it, then readjust. Put it on however you can. If you can get it on correctly, always go that route. But if you can't, get it on, get it out where you can manipulate it, and then readjust. And then reset. And then start.
Now, we had one calf over here that had a head back, and that's where this head snare comes in, because it's pretty tough to put those chains around their neck. It's not long enough, and you just choke them off. So this goes over the back of their head, and this part goes on. So this is my head. This part either goes underneath my chin or in my mouth, one or the other. And this isn't meant.
It's more of a vet thing, isn't it?
Well, this isn't meant to pull the head out like you're going to pull with those chains. This is just meant to get the head positioned into the pelvic canal so it starts coming out, so that they're coming out like that. So this is not really, you don't really pull on their neck like this. So I guess, Dan, this would be a good time to show them if you need to use a calf jack. Most of the time we think that if you get one or two people on that cow, if you're pulling down in the right manner and everything, that usually should be enough to get the calf out. Sometimes, if we think we can still do it safely, then we'll get the calf jack out and we'll use that. And Dan will demonstrate that.
And one thing to say about these is it's a very good tool to have, but you shouldn't use it very much.
It's not the first tool out of the toolbox.
There's too many places I've been where they bring a heifer in or a cow, and everybody grabs this, and then they just start cranking. And you end up tearing up a lot of stuff. If you need it, it's good to have. If you use it properly, it's a good tool. But a lot of people do get impatient with them. All the same strategies and everything with using these and handles should come into play. You want to pull with her contractions. You want to do everything you can. Because once you hook this up, you're putting a lot of pressure, not only on the calf, but on the cow as well.
And this chain goes over their tail head, and this goes up against their rear end. We don't want to take the power off. That's okay. And so that's the way that goes on. And then Dan will show you how this thing works.
If you can see, well, on both sides you can't see, but there's a hook just like this on the other side as well, and there's one in here. And you can see that they were thinking when they designed this, because you don't want to pull both feet at the same time, because you'll just square up their shoulder. If you work them out like this, you can kind of elongate them. So if there's one hooked here, a chain hooked, then you can just off the wrist.
And the chains hook right into these little hooks. They're meant for that.
So whether you have an individual chain on each hook, or if you just use the same chain, some of those chains are made long enough, you can just go from one hook to here and on to the other hook. So when I ratchet it, it's going to pull this one, it's going to pull that one, and then it's going to pull this one. And it'll pull that one, and pull this one. Yeah, exactly.
And that's really nice, because that way, as Dan said, that one leg comes out a little bit, and then the other one comes out, and so you get those shoulders through that pelvis a lot easier. It works a lot better.
And then with this, once you get chain hooked up, and you'll take up your slack here, and this is not designed to crank them out like a come along. You're not pulling the Jeep out of the mud. So you're going to get a pretty decent tension, and then on this, give it pressure down.
That pulls that calf out and over.
Let it come a little bit. Lift up your slack. Down a little bit more. You don't want to climb on here, jump up and down. I mean, hopefully we're still taking a live animal out of a live animal, and we want to keep them that way.
If your cow is contracting for you, do you wait for her contraction
I
and
do.
then?
I do all of my pulls, whether I'm with the handles or with this. I might get this get the tension on there, and then I might wait for her to contract. And then if she's contracting, then I'm going. And then when she's resting, I'm picking up my slack, waiting for her to contract, and then I'm going down. So these are really good tools to have, but after a while you might think, boy, I wasted a lot of money buying that thing because I haven't been using it, but that's a good thing.
Yeah, that's a really good thing. It's great to be prepared, but it's bad to use all these tools too. So you kind of have to. So you've got the calf out, and then what kinds of things should you do for that calf right then? What are some of the considerations? Colostrum, that first milk, right? And so, you got a hold of the cow one way or another, out in the pasture or in your chute. And maybe just milk her out right then. If she's tired, she's not going to kick in as hard. And just go ahead and get that colostrum right then. The calf's probably going to be weak, and then you can put it in one of these esophageal feeders and go ahead and give it to the calf right then. You don't have to worry about waiting for the calf to get up for the next 2 or 3 hours or something like that. And go ahead and get that first colostrum into them.
I've heard scary things about those.
Scary things about these? These don't look very scary to me.
If you don't get it down the right way, that you can actually get it down a lung and kill your calf.
Yeah, when you put this down the calf's mouth, it could go either into the esophagus or into the windpipe, right? Into the trachea. So how do you tell? Well, it's got this handy little ball on the end of it, which makes it smoother. And when it's going down the side of the neck, you can see it or you can feel it. And so when it's in there, you can move it up and down, and it should be about halfway between the angle of the jaw and the chest wall. That's where you want this. You don't want to put it all the way into the chest, because then it kind of tough on the breathing. So you want it about halfway down, and you can sit there and you can move it back and forth. A little bit of J-lube or a little bit of this stuff on it would be fine. A little mineral oil, olive oil, whatever. It's smooth. You want to keep this crimped over so the fluid isn't running in. And you put this down their throat, move it up and down, make sure you're in the right spot on the neck. If it bulges and you can feel it and see it, you're in the right spot. If you can't, then you're in the trachea. So the trachea, remember, is a solid walled tube, and the esophagus is flexible. And it's on the left side of the neck, almost always. 99% of the animals and people, the esophagus is on the left side of the neck. So you put it down there, get it going, open it up, let the stuff run in. So that takes care of the colostrum. What else do we need to do for that calf right away?
Give it a name.
Give it a name. Give it a name. We got names over here. This one is
Hector?
no, this is 3251E.
How about Timo?
You can do the name, put an ear tag in it, take a DNA sample if you want, right there on the spot. What else? Make sure it's breathing. Yeah. Anything else? How about the navel?
Yeah, iodine, disinfectant with iodine.
How about the navel? You've had to bring this calf in or out in the mess in the pasture. Got a bunch of dirt, manure on that navel and stuff. You want to clean that navel up. And
You mean the mother, she's not going to naturally lick it?
oh, she'll get around to it eventually. But you've already got a big mess made. So you've already got it contaminated, especially if you brought it to the barn. So what I recommend is to have a wide mouth container. This one isn't quite wide enough. I like to use like a Metamucil jar or something like that that's got a big wide mouth on it, and have it full of iodine solution or Novosan or dilute bleach or whatever you want to use, and put it right up at, put the navel or the umbilical cord, which is going to be about that long, and you just stuff it right inside there and just slosh that around right up against the belly wall. And by the time you get done, you should use about half of that fluid. Half that fluid should be gone. And that will disinfect that navel and do a good job, and probably do that for the next couple of 3 days if you brought the calf into the corral. If you've calved it out in the pasture, then once or twice is plenty good. So you want to disinfect the navel, make sure it gets some colostrum,
Now,
What
the
else?
colostrum, is that what you milk from the cow, or do you have, can you buy that somewhere and have it on hand, or?
Well, you don't want to buy it somewhere, but if you save it from, once in a while you'll get a cow in and she'll have a lot of colostrum. Just go ahead and take a little bit off. And if you've got, what do you guys have up here? Got 3 or 4 quarts of this in the freezer? If you've got 3 or 4 quarts of this in the freezer, that's fine.
So we can come here. We need some.
No. This is homemade. You make this at home yourself. And
That's something we used to do,
don't get it from a dairy.
yeah. We used to do that. Not here, but when I started in the business, we would go to a dairy and get colostrum, so we'd have colostrum oil. So the colostrum is made from the mother, from all of the diseases, vaccine, whatever. So it's kind of indicative of this place right here. So I want to use, that's my first choice. If I have to use colostrum from a different cow than the mother, I want to use colostrum from the same herd.
Yeah.
And second choice would be colostrum from another beef herd in the area. On down the list, there are some commercially available colostrums, but the same type of thing.
They're not quite as good, but they're better than nothing.